Yeah, I'm very much into media, and I'm reminded about the story that hit the media last month. The National Obesity Forum published about fat versus carbohydrates. Fat is good, carbohydrates is bad. Public Health of England responded back to the National Obesity Forum of being premature and irresponsible to publish something like that without being peer reviewed. As healthcare professionals, we have a serious duty to provide a clear message towards the public. And this is not the first time something like that happened. Going back to the 1981, where there was a serious link between coffee and pancreatic cancer. I mean, the people were wondering if they have to get rid of their cup of joy in the morning. So 1 minute, and then cellular phones, 1993. Cellular phones, cook your brain. After that, that was a scandal to the healthcare professional, a complete scandal, where a scientist known as Andrew Wakefield just maybe had a conflict of interest and published that there is a relation between MMR vaccines and autism. And it really made the public wonder, do I have to really vaccinate my kids or not? It's it made that sort of wondering thing between the parents have to vaccinate their kids or not. And then there was a child, his name is Marco Arturo, and he published on Facebook, there was a video circulating around, and he was trying to prove to people that there is no relation, no evidence between MMR and autism. From there, PCB in farmed salmon as well, PCB is used as an additive in paints or in loads of electronics, and imagine that was found in our food and how much that poses as well conflict to us as the public. MRSA, that was a very, very good point where we start to raise up the mechanism resistance awareness against antibiotics. So if we go back 70 years, between the 1940 and the 1960, and before the golden era of antibiotics, the predominant cause of death was infectious disease. So that's why we start to raise that awareness to people that if you don't need antibiotics, wait a bit, see how you feel, if it's a viral infection, and we start to raise awareness against antibiotics. Red wine and antioxidants. 1 minute, drink a glass of wine, it's perfect. The second minute, you're not allowed a glass of wine. We are oxidizing machines in ourselves. We're always oxidizing out the glucose and stuff. And the last one, fat is good and carbohydrates is bad. As healthcare professionals, we have a serious duty to provide an unambiguous and unmistakable message toward the public. The public needs to know. Let me introduce myself. My name is Hala Jawad, and I'm a practice pharmacist within the IMH group. As well, I have a background of community pharmacist, and I'm an RPS moderator for Public Health Network, and I have an interest in patient-centered care, and I'm a prolific tweeter as well. I graduated from the University of Brighton, where I spent 4 lovely years, and my final year project was about motivational factors affecting pharmacists during, before, and after becoming a pharmacist. And probably there will be a publication soon for that.